Hello and welcome to ashford.com. You are watching an interesting video on users of non-steroidal anti-inflammatory drugs are at increased risk of VANO. Please read this disclaimer carefully. Users of non-steroidal anti-inflammatory drugs are at increased risk of venous thromboembolism, according to a new study published in the journal Rheumatology. Non-steroidal anti-inflammatory drugs, NSAIDs, relieve pain and reduce inflammation. Millions of Americans take NSAIDs for musculoskeletal problems, sprains, strains, back pain, headache and painful menstruation periods, as well as chronic conditions such as arthritis and lupus. NSAIDs, including drugs such as aspirin, ibuprofen, Advil, Motrin, naproxen, Aleve, and Celecoxib, Celebrex, are known to be associated with the following side effects: stomach problems like bleeding, ulcer and stomach upset, high blood pressure, fluid retention, causing swelling, such as around the lower legs, feet, ankles and hands, kidney problems, heart problems, rashes. Some previous studies have linked increased risk of venous thromboembolism, VTE, a condition that includes both deep vein thrombosis and pulmonary embolism, with NSAID use, but the evidence has been limited. For the new study, researchers from Bassett Medical Center, New York, performed a systematic review and meta-analysis of the available observational studies that evaluated risk of VTE in users and non-users of NSAIDs. The researchers compared one cohort study and 5 case control observational studies, which included a total of 21,401 VTE events. They found that NSAID users had an overall 1.8-fold increased risk of VTE compared with study participants who did not use NSAIDs. This is the first systematic review and meta-analysis of published observational studies assessing the risk of VTE among NSAID users, says lead author Padampong Ngprasert. There are some limitations, however, Ngprasert cautions, such as the fact that all NSAIDs are evaluated as one group in this study but not all individual NSAIDs may increase the risk of VTE. Our results show a statistically significant increased VTE risk among NSAID users. Why NSAIDs may increase the risk of VTE is unclear. It is possibly related to COX-2 inhibition leading to thromboxane prostacyclin imbalance. Physicians should be aware of this association and NSAIDs should be prescribed with caution, especially in patients already at a higher risk of VTE. References